Hi everyone, I'm Jiayan Huang. Today I'm going to talk about my proposal to open a new PACE center in downtown Los Angeles. PACE stands for Programs of All-Inclusive Care for the Elderly. It provides full services in one system, including medical care, transportation, meals, and social support, so that older adults can age in place with dignity. This project explores how a PACE center could help meet the need of different seniors in downtown Los Angeles. PACE has four key advantages. First, it reduces hospital stays by focusing on prevention. Second, it helps participants stay in their homes longer with the right services. Third, it improves quality of life, both physically and mentally, by offering different kinds of system care. And finally, although there are PACE sites in LA County, downtown Los Angeles remains unserved, so the need in this area is especially urgent. The number of adults aged 65 and older in LA County is expected to double by 2030. In neighborhoods like Skid Row, Chinatown, and Pico Union, seniors face serious healthcare access issues. They rely on public transportation, often don't have regular medical care, and socially isolated. This growing demand puts pressure on emergency services, making it even more important to create a local community-based option like PACE. So for the PACE model expand, PACE use a team-based approach. Doctors, nurses, therapists, and social workers work together to create and update care plans for each participant. Medical care is provided at a PACE center, at home, or in the hospital when needed. But PACE goes beyond medical treatment. It includes transportation to appointments, meals, social activities, counseling, caregiver support, and help with daily tasks. These whole person models help participants stay healthier and more independent for longer. So when designing a downtown LA PACE center, the center must reflect the diversity of downtown Los Angeles. Staff should speak languages like Spanish, Korean, and Mandarin, or any other languages, and materials should be culturally appropriate. The facility should include exam rooms, dining spaces, therapy areas, and office, all designed to be in ADA requirement and easy to access. It should be located near public transportation, affordable housing, and other community services. So for the location considerations, the ideal location will be a repurposed clinic, school, or community center. To reduce costs, we will explore grants, tax incentives, or reduce rent options from local government. Co-locating with other nonprofits or aging services could help us share resources. And of course, the site should be near public transportation with enough parking for staff and caregivers. So for the staffing requirement, we will need a full medical team, doctors, nurses, and therapists who experience in elder care. We also hire drivers, enrollment specialists, IT support, diary staff, and other workers. Partnering with USC or other universities in Los Angeles can help us bring in student interns and clinical trainings. Ongoing staff meetings and training will help maintain a high level of care. So for the financial considerations, starting a PACE program is expensive. Initial costs are expected to exceed $3 million, covering renovations, vehicles, staff, and technology. PACE operates on a capitalization model, meaning we receive a fixed monthly payment from Medicare and Medi-Cal for each participant. To help with startup funding, we apply for grants from California DHCS and private foundations. So getting license takes time. We must submit a full proposal to the Centers for Medicare and Medicaid Services and the California Department of Healthcare Services. We will need to prove operational readiness and pass a site inspection. Approval usually take 18 to 24 months. After opening, we will continue internal audits and performance tracking to stay in a good condition. We plan to partner with organizations like JWCH Institute and Ether Health to help identify eligible seniors. We will also work with groups like St. Vincent Meals on Wheels and local housing providers. Outreach efforts will include town halls, multilingual flyers, and participation in health fairs to raise awareness and build trust. So the successful PaySize give us a strong model to follow. Altamed East LA program works well because it offers bilingual services that align with the community's culture. Rampant centers operated by LA Jewish Home succeed by combining medical and social care while respecting religious and cultural values. The most successful programs all have strong local connections and tailored services. So our plan starts with a market analysis and forming a planning team. Next, we will choose a location, secure funding, and begin the licensing process. Finally, we'll also build our technology system and data protection. We'll open the center and focus on creating strong relations with community partners. Our goal is to create a PACE program that truly serves the diverse needs of all the adults in downtown Los Angeles. Thank you.